Hi, welcome, and thank you for your presentation.
Well, thank you very much for the invitation and the opportunity to present on this beautiful platform. And it has been a very interesting day so far, so I hope I can contribute that with my very small 15-minute presentation right here. Now, the topic I would like to talk about is atraumatic surgical CI technique with hearing. Also, if you look at the program, the following three presentations will be about hybrid hearing and hearing preservation surgery. So, as an introduction, that this can be valuable. Can I have my next slide, please? So, in the cochlear implant portfolio or electrode portfolio, looking primarily at two solutions, and the one that is most popular in Europe is the one you see now on the screen. It's the CI422 with the slim straight electrode. Next, please. But also part of that portfolio, we have the hybrid L electrode, which has been recently approved in March 2014 to be used in the United States. So while we have seen the number of hybrid electrodes being used in Europe going down slightly in favor of the CI422, we see now that in the United States it is growing again. So it's going to be interesting to see in the future what's going to happen with the hybrid electrodes. Next slide, please. Now, both of these electrodes are mounted on the same implant platform, which is the CI24RE, where, as you can see, it is the world's most implanted CI with largely over 100,000 recipients today. Next, please. Now, when we talk about hearing preservation surgery, and it also became clear from most recent literature, the round window approach is the least traumatic approach. So when you are using the round window approach, there is no risk because no bone dust is going into the cochlea. You don't drill a cochleostomy, so the vibration on the cochlea is also going to be less. There's a reduced risk of bone dust incorporation, reduced risk of breaking intracochlear structures like the osseospiral lamina or the basilar membrane. There's also a reduced risk of cochlear fluid suction because you can actually clean the whole area right before you open the round window membrane. And obviously, by definition, you are in the right scala for the insertion. So we have seen round window being more popular in the most recent years compared to the cochleostomy approach. Next, please. When you're looking at hearing preservation surgery, there are certain points that I would like to draw the attention to. And for a lot of you, this is probably going to be a lot of repetition. And I really want to use this presentation a bit as a refresher for the surgical technique that can be used. Now, certain points of attention have to do with the surgical technique as such, but also using the implant or inserting the electrode. And the company has provided a very thin long electrode or full-length electrode as the CI422. But then inserting that electrode should down at a very low pressure wave inside the cochlea. Now, also, unwanted movement of the electrode after the insertion is something that we want to avoid. And therefore, I'm also going to talk about the closure of the cochlear opening through the round window by using a collar of fascia that is mounted on the electrode before the insertion. Now, this is something that was inherited from the surgical technique that we have trained from 2007 onwards when the hybrid L came to the market in Europe. And together with Professor Lennox from Hanover and Professor Stover, who at that time was also in Hanover, we trained some like 140 surgeons in Europe to this hearing preservation technique. So that is something that I also would like to share. And it might be an idea for your future cochlear implantations as well. And then finally securing the electrode lead. Now, you will see that hearing preservation surgery will not be largely different from the regular surgery or the surgery for the regular deaf ears, as we have seen so many years ago. Mastectomy, identifying facial nerve quality would normally do. A wide facial recess is important to have a good visual on the window and the promontory, but also if you use a technique like for hybrid, and you want to use a groove, you should have a wide facial recess, but still leave a little bit of bone in between the chorda tympani and the facial nerve to make that 0.6 millimeter of width, and I'll be talking about that a little later. Next, please. Now, the steps that you will see appearing in color are the ones that I would like to highlight a little bit more in this presentation. So exposing the round window membrane, tissue color preparation, the opening of the round window membrane, insertion itself, which should be done very slowly, and the electrode in the mastoid. Next, please. Now, these are images that I can use from Professor Lennart's from Hanover, where you see on the left-hand side a really beautiful exposure of the round window. And on the right-hand side, it is a similar view, but where the round window is covered with a false membrane. So also there, when you would like to see the round window very clearly, it is important to remove the false membrane, because it could be very close to the real membrane, or when you assume that there's a false membrane and you take it out, it might have been the real membrane and you open the cochlea that way. So this should be done very carefully. Next, please. On the image, you see a nice view of the posterior tympanotomy, where in the inferior part between the chorda and the facial nerve, there is a small groove. Now, that groove was advised for the hybrid L electrodes, and I'm repeating this for whomever dialed in from the United States, where the hybrid just recently has been approved. So it was part of the surgical technique that we advised, where a small groove, a 0.6 millimeter groove, would be drilled in that area, and it is close to the chorda and the facial nerve. But when you identify, you know exactly how much bone you have left for that small groove, and then you would stabilize the hybrid L electrode in there using the 0.8 wing. Silicon wing that is mounted on the hybrid electrode. That is not necessarily the same technique. Next slide, please. Not necessarily the same technique that we would advise for the CI422, because there's also a handle on the electrode, which is more for the orientation rather than the fixation of the electrode itself. So orientation is one thing. It's also the location where you can hold the electrode with the AOS forceps, going slightly over the wing and holding the electrode with the angled tip. It leaves the instrument outside of your view, and you will have a full view on the electrode array, including the two white markers that are mounted on the CR422 slim straight, so that you can control also the insertion depth. Next slide, please. The sealing the round window membrane is a very important aspect of the surgery, and usually this is done with small strips of fascia that are draped around the electrodes, and sometimes fiber and glue is used to make sure that it is sealed well. When we did the training for the hybrid L electrode, we used a tissue color that was from temporalis fascia as well. Where it was put on a pointy instrument just to have a perforation of that soft tissue, and then let it dry, because when it's dry it's slightly easier to manipulate. And then just prior to the electrode insertion, you can slide it carefully over the electrode array before the insertion. Next, please. Now, there is a small risk when you make the collar too large. It can block your view on the round window. So it is important, but the moment that you prepare that tissue collar, that down to the size that is the same size of the round window itself. And it is not a bad idea to prepare a second one, just in case that when you take the first one and it kind of comes out of your forceps, then you have a spare one that you can use. And since you are bringing the electrode into the cochlea, it's always a good idea to rinse it so that there's no blood or no bone dust attached to the electrode array before you insert it into the cochlea. Next, please. This is an image that I am allowed to share. This is an image from Kuopio, from Finland. The surgeon was Dr. Arno Dietz. And you can see here the CR422 slim straight electrode where the fascia is mounted and has moved up to the level of the handle so that the two markers are still visible together with all 22 intracochlear electrodes. Next, please. Now, for the opening of the round window membrane, there are several techniques. And the technique that we have seen being very successful with the hybrid insertions is when you use a hypodermic needle because it has a very sharp tip. Now, the hypodermic needles have different diameters. So when you use a 22 gauge needle, it will give you a diameter of 0.74 millimeter. So that should be large enough to allow the 0.6 millimeter electrode array to go into the cochlea. Now, this is typically something that you want to do when everything else is already in place. You have put the implant in place. You might have put the ball electrode under the temporalis muscle, and the insertion of the electrode is basically going to be the very last thing that you do. Next, please. Now, there is a certain risk when the incision is too small, or if you put the needle a little bit too far in the electrode, that you damage the basilar membrane. So, again, as everything in surgery, it should be done very controlled and very carefully. Next, please. So here, just the three images that I want to show you of the beautiful exposure of the round window in one of the hybrid surgeries by Professor Lennartz. Next, please. And here you can see the hypodermic needle coming in place, perforating the membrane, and on the last image you can see nicely the half-moon shape incision that is made in the membrane of the round window. The electrode insertion then should be done slowly. We don't want to create a pressure wave inside the cochlea. If you insert the electrode too fast, the perilimb inside the cochlea has no way to escape than going into the helicotrema and then going down into the vestibulum. So a slow insertion to allow the displacement of the perilimb is very important. Use a clean electrode, and the AOS forceps, although this is not an AOS insertion technique, the AOS forceps is a very useful instrument because of the rounded tip. It's a very gentle grab of the electrode without damaging, and then you have full insertion when you reach the first marker on the electrode array. And as you know, there's two markers on 20 and 25 millimeters, so you have another 5 millimeter of extra insertion if you want that. Next, please. So risk is that the vision is not good enough, but you can take care of that by having a large enough posterior tympanotomy, the color not being too large, and also the angle of the microscope can be very important. Make sure that you have a good vision on the full length of the electrode. Do not do it too fast for reasons I just explained. Suctioning should not be done once the round window membrane has been perforated. And of course, you want to avoid all uncontrolled movement of the electrode. And that's also why we want to have that fascia color, so that there's no strips that are draped around, and by touching the electrode, you might have some unwanted movement. This is a very short video that I would like to share with you. This is an incision that was done by Professor Senaroglu in Ankara. So the incision has been made. You can see that beautiful half-moon shape in the membrane. And then the electrode array is advanced in the cochlea very slowly, very controlled. So I just let you enjoy that beautiful insertion. You can see the white marker already appearing in the screen, in your view. where actually right now it is going inside the cochlea, passing behind the membrane of the round window, achieving full insertion of all of the active electrode contacts. Next, please. The hybrid hearing is not just by the electrode or the implant itself. With Nucleus 6, we have an option where the ear hook can be replaced with an acoustic component. And this is something that is done very easily. Next, please. So in 3 steps, basically, you can see that the first image, the ear hook, the regular ear hook is removed. On the second image, the image in the middle, you see that the ear hook for the acoustic component is mounted on the sound processor. And then finally, the bit for the acoustic implant with the dome is inserted into the ear hook. So it's a very easy change from a regular processor to the hybrid hearing processor. So in summary, we can say that surgery can be done carefully, which is obviously not something new for a group of surgeons. Around the window approach for hearing preservation surgery, slow insertion of the electrode, and you can use the CR422 with the slim straight, which is giving excellent hearing preservation results. And in the US, recently the hybrid L24 has become available. And then, next please, let's not forget the acoustic component mounted on the Nucleus 6 processor. So with that happy note, I would like to thank you for the attention, and I give the floor back to the panel in Utrecht. Thank you very much.
Thank you. That was a great introduction to the afternoon session.